start here. Thank you very much for joining everyone, for joining today's webinar. My name is Craig McInnes. I'm a co-CEO at myCaribou, and I'll be hosting today's session. myCaribou is the only global partnering hub built specifically for the medical device industry for manufacturers and distributors that will help you accelerate your growth through stronger partnerships. You can sign up for the platform for free. It is the link should be here for you in the chat panel, and I'm going to do a brief demo at the end of today's presentation. So after we wrap up the Q&A, if you want to drop off, feel free to do so, but I will stay on for a few minutes and show the platform. So unfortunately, you know, we're all used to dealing with illness and these times right now, but Marco Kalms, founder and CEO of Kalms Consulting, was unable to make today's session, but we are very fortunate to be joined by his colleague, Dr. Benjamin Schultz. So let me introduce Dr. Schultz. He's an expert in medical technology, market analysis, and strategic business development. He holds a PhD in physics in the fields of optics and bioorganic systems. With Kalms Consulting, Dr. Schultz has extensive experience in strategic business development with medical technology companies as they assess market opportunities in Europe. Dr. Schultz will introduce Kalms Consulting on a subsequent slide, so I'll hold off on introducing that. Thank you for joining us on short notice, Dr. Schultz. We really appreciate it. Over to you, Dr. Schultz.
Thank you, Greg, for having me. And yeah, sorry that Marco couldn't make it, but I'm happy to discuss today with you actually how we tackle the market access. And I think that is what this topic today is really about, to look into the market and to understand how we can do this. For that, I compiled some information on the healthcare market in Germany and how the reimbursement system works, but also what kind of options we have in the reimbursement system, because it really depends on your product and your method in the end, where you are situated. And this is what we do. We try to position you and your product and your method into the healthcare market and make sure that you get the right, the right pathway to the market. And for that, of course, the reimbursement initiatives need to be known and need to be ranked in a way. And that is always connected with evidence, for example, so with evidence needs. And the last thing, which is always important for everyone to discuss, is how to find a price in a market where the reimbursement is set from the outside. Some words about Kalms Consulting. Kalms Consulting is about 10 years old and is, from the historic view, split into two parts. We have the Kalms Consulting area, which is where I'm coming from. We are concentrating on helping in the market access area, basically in every step on the way. And the Kalms operation is more an operational support company, which becomes more and more important, especially for smaller companies who need a very dedicated and focused view or help in the German market to process and logistically support their product access in the market. For the Kalms Consulting services, we do everything from supporting and creating regulatory documents. We are not a notified body, but we are kind of helping in structuring all the documentation needed. We have team experts in the team who have been extensive experience in the regulatory area, but we go further than that, and that's my area where we look into the market, do market access analysis, do reimbursement applications, and do the corresponding business development in that, going that far that we support companies which are on the German market for a longer time in creating the documents they need for prior authorization projects and other different projects to be successful in the German market. As you can hear, we are focused on the German and German-speaking markets. We are a company which has a lot of partners in the world for other countries, so that we can also run international projects when it comes to, for example, a European market access. But we will never do that on our own, because we think that the local partners and the local people who are living in those countries are much more experts in their respective healthcare systems and know how to approach these systems, but we can kind of do the overarching management on those. quick word on the operational services, which is our part of the Kalms group, so it's part of the same company, but it's a different branch. And they are ISO 13485 certified to process all the medical devices which are part of our portfolio, handed to the hospitals, to the doctors, support the doctors with call center or information in different languages. We can also do the technical support. We can do the field service engineering. We are growing according to the needs of our clients, which has been very strong in the last year, because we simply see that there are many companies who are too small for FedEx, UPS, or DHL, but too large to do it just with a single person in an office. So that is what Kalms Operation is about, is really trying to make sure that the logistics and supply chain of the medical devices from the manufacturer to the hospital is being made sure. Importing is also something which we do. Having said that, let's look into the healthcare market in Germany, and let's look into the actually largest EU healthcare market, which is still a reference market for market access, even though it's a complex market. And to be able to be successful in the market, in my opinion, is always there needs to be a thorough understanding of the market, how it works and how it's being separated, because it has two important separations which are determining your position in the market. The first separation is between the public and the private health insurances. We have the vast majority of people in Germany being statutory health insured, which is an obligatory insurance. When you are employed, your employer will pay roughly half of the cost for the insurance. You will pay the other half. And this is what is the sustainable and long-term market in Germany. And this is the market you should tackle when you are interested in market access. The big obstacle for that is that this also means that a German, typically insuree of a statutory health insurance, does not know what health insurance costs, does not know what health services cost. So there's no real cost awareness and reimbursement awareness. So it's really up to us to look into the catalogs and see how things work. And speaking about the catalogs, we have the inpatient and the outpatient catalogs with different acronyms here. I won't go through that in detail, but I will show you two examples later on how these catalogs work and how the reimbursement work, because that's also very different. And that's the second distinction or the second separation we have in the German market. We do have the inpatient services, so everything what happens in a hospital where the patient stays overnight in the hospital is an area where we have a dedicated reimbursement system, and where all new methods, and that's very important that the German healthcare system does think in methods and not necessarily in a product which is reimbursed. It's always a method which is reimbursed in which this product is being used. In the hospital, those methods which come new or are being altered by new products can be used at the discretion of the doctor. This does not necessarily mean that they have reimbursement, but they don't need an explicit allowance, which is called permission with reservation of prohibition. So if the authorities in Germany will not allow a certain method, they have to distinctly say that. While in the outpatient setting, where we have the doctor's offices, the doctors who are these are GPs or specialized doctors, but not in the hospital, they have some kind of a final catalog of procedures they are allowed to do, and if they would do something else, they will be never reimbursed for that, other than this method will be distinctively allowed by the authorities. And these two distinctions are very important to understand when entering the German market. One is we have a large chunk of statutory health insured patients, which is the sustainable market. And the second is, even in the hats of the health insurances, in the authorities, in the doctors, there is this distinction between inpatient and outpatient services. Right now, there's a lot of going on in Germany. We think that the January and February will be a tough month for us because there are a lot of changes happening because everyone has understood that this system, this very rigid system of inpatient versus outpatient is not a good system in the long run. And this needs to be kind of altered and changed. And that's ongoing. So we are also looking forward to next year, and we'll see interesting developments, I think. So how does the inpatient reimbursement work? Because I think that's the next thing when it comes to market access. You want to understand what are your advantages and options to kind of enter the hospital market in the first place. The hospital market will be easier to enter because of this approach that you can just be there, and if the doctor is accepting it, you can start, and if you have a CE mark device, you can start using it. But the reimbursement works in a way that we have a catalog which describes the indication where the patient comes in, which is the so-called ICD catalog. And then we have everything which is done to the patient while he's in hospital is being described by procedures. So these are the methods I've been talking about. And what is important is that both of these are not connected to any payouts yet. It's just a description of the patient treatment which is happening while he's in hospital. The combination of all those numbers plus the age of the patient, the comorbidities of the patient, all these things then lead to a DRG, and that DRG is kind of sorted into the area where the patient is treated, like cardiology or hepatology or whatever, and the complexity. So the more complex the treatment is, the higher the DRG gets. And that DRG is a lump sum. So that means that once the patient enters the hospital until he leaves the hospital, it will be the all-in amount of payment the hospital will get. So the hospital has to cover the costs for the doctors, for the materials, for the drugs, for the OR infrastructure for that single patient with that single DRG. There are other items which are can be reimbursed on top of that. For example, so-called additional remuneration, Zusatzentgelt is a German term, which is for very expensive implants or chemotherapeutica, which are not needed for every patient, but only for several ones. And there are programs to advise or to advance highly innovative new methods into the system, which is called the NUB program, where the hospitals have to apply for. Also, there are changes ongoing. One example for this change is that until 2019, we had with lump sum of the DRG, really all costs, including the nursing costs. But because the nursing has such a problem recruiting new personnel, the idea was that is carved out now, and the hospitals will get a separate fee on nursing to make sure that they can pay all the nursing. That's not really working yet, but we are hoping that it will work in the next years to come, and that this nursing revenue will go up. And therefore, we always have to look into the DRG catalog when we talk about a new method, but also have to see what kind of changes are happening or have happened to make sure that we kind of cover the situation of the product in question. Just to give you an example, this is how we would attack such a market access. In this case, you can see it on the top of the slide at the DRG M02B, which is a DRG which covers the treatment of prostate hyperplasia. And what is important when it comes to the economic thoughts is just the figure we have in the middle of the slide, where you have this red line and the blue line. If we just look at the red line describes the payment for the hospital depending on the length of stay of the patient within the hospital. So that means that the hospital will get about 3,000 euro. That's the red line plateau we see here, independent if the patient stays 2 nights or 9 nights. And there you can already see how a health economic approach for a new product, for a new whatever, software tool, anything which can change the patient treatment, the patient procedure course within the hospital, the idea is behind that. And this is what we do in the market access. We look into the situation, the positioning, and try to find out what kind of argumentation do we have. This is a very obvious one, because if you can shorten the length of stay, you will save the hospital some money. If you shorten it too much, you can see this as well here, the hospital will lose money again. If you are too close to this edge in the area at 2 nights, things are also not good, because then the checking organizations of the hospital might say, why did you take the patient in the hospital at all? And that's also not good. So there's some kind of sweet spots we have to find, and we have to look into for each project. The second thing is not that obvious, because I've been talking about that this DRG is about 3,000 euro. That would mean that you would think, okay, I do have some kind of maneuvering within 3,000 euro. That's typically not the case. Typically, DRG is comprised out of a huge matrix, depending on where costs are occurring and who is responsible for those costs. And the 3,000 euro you see in the lower right here, but all the different items have to be accomplished or have to be accounted for. And this is also when we look into a project, we need to understand where an implant, for example, which is category 5 here in the middle, or it's more personal related, or it's OR related, which are the green boxes. So it really depends where you are. That's the inpatient area, the inpatient setting. The outpatient setting, though, is rather different, because the inpatient setting was a lump sum, while the outpatient setting is a sum of services. So you have a service which is that the doctor will see you and will talk to you and will do an initial diagnosis. Then you have another service which is a small surgery, like stitching a cut or something like that, or it's a diagnostic which is being performed. And for all of these services, you will get there's a single catalog entry item connected with a reimbursement value. And all these things together will create the reimbursement the doctor will get for the treatment of the patient when the patient enters the doctor's office. And the materials which are may be part of this treatment are invoiced most likely directly to the health insurances. So you see, this is a bit more complex, and it really depends a lot more on the method and the product we are discussing. So what's the patient pathway? How is the patient pathway changing with the usage of that product? And what's the existing reimbursement? Is there existing reimbursement? How do we need to change that in a way? And these things are, this is a very much more individual part. We cannot also not rely on so much statistics as in the hospital sector, because the German statistics very much focus on the hospital data, and there's less data on the less public data on the outpatient sector. You have to go more to the hospital, to the health insurances, and ask them for support there, which can be done, which is a bit more, let's say, troublesome. Just a very quick example here that's an ophthalmologist's procedure, and you can just look at the headlines. There's a surgery which is then in the outpatient setting. The surgery is just being categorized by the length of the surgery itself and by the area of the organ where the surgery is happening, and not more than that. And you can see that for this case, and it's a complex one. X1 is the most complex, and X2 is the second complex. It gives 400 euro. That's only the service for the physician. That's not including materials or any implants or something like that. That's extra. And then we have a surveillance, which is a post-operative surveillance, or we have a follow-up surveillance if we have a physician who has been forwarding it to the surgeon. So you end up with about 500 euro if it would be in within the hospital, which is where the material is being given by the hospital. It would be only 200 euro for the physician. So you can see it really depends on the setting. Where are you? Are you in a hospital where the outpatient doctor comes in and does it, or in a clinic where the clinic has the services, or is it within the office? That's a really individual discussion which has to be done, but it again requires a positioning of your method in the German healthcare system. These two items are the main items, inpatient and outpatient. There are other options for reimbursement. One, for example, is the medical aids, which are devices which are be taken home by the patient, like a walking stick, a wheelchair, special diagnostics for diabetes, all these very patient-centered devices where the doctor is the one who prescribes the device. The patient goes to a dispensing store and gets the device, and the health insurance will pay for it, and they will typically pay the dispensing store. So you can already hear there is kind of a rather complex structure of contract partners, and it's a catalog. You can enter that catalog, you can apply for it, and you have to also here position yourself and see at which point in the catalog you could enter, what kind of prerequisites you have to follow if you want to enter that catalog. For each category, there are numbers of prerequisites you have to follow. This is something where we typically write applications if needed and discuss with the authorities you see on the right, the GKV Spitzenverband and the Joint Federal Committee, Gemeinsamer Bundesausschuss, who are sometimes responsible for creating these requirements and are responsible when it comes to questions to them. Another example, because I said there's a lot of going on in the German market with new reimbursement options coming in the next year. Another example, which is already there for a couple of years now, is the digital health options. There is a program on digital health applications, which is called DIGAs. Those DIGAs are software tools which are patient-centered and have a digital functionality. And that itself is kind of a filter for everyone, because the idea is not to collect diagnostic data, give it to the doctor, and the doctor can make a better diagnosis out of it. It's more that the patient gets is set into the situation that he can control and kind of help himself with the software. So the first DIGAs were a lot of DIGAs in the psychology sector, where you have a kind of a diary which you fill in, some questions, some questionnaires which you fill in to make you feel better, to kind of control yourself. But we also have DIGAs in the field of dietary options. So having a training program, exercise, diet lists. There's a diabetes DIGA where you kind of have the diet data from the blood sugar measurement, but also some kind of a lifestyle changing options. These DIGAs are being paid for by the statutory health insurance, and you can enter that program by applying to the authorities to be part of that. And the good thing is, and there the German healthcare system has learned that for this program, there's a there's a kind of a line in between before entering the program where you can ask the authorities if they think that you are right there. So this is what we've been doing also with our customers. We went to this and did the consultation with the authorities so that not too much money is spent on any development, because if you know what you are doing, and if you have reached a certain milestone, you can go there and discuss with them if that is kind of working. I won't go through that slide, but this is something which we're going to do with our customers. And I've been discussing all the different options and all the different ideas and the different pathways. And from the positioning, we end up in a pathway where we say, do you have a reimbursement already there? Is there an existing code? Is there an existing pathway? Or, and that is more often the case, is there any reimbursement initiative you have to take? So do you have to do an application for a code? Do you have to do an application for a consultation? And for that, you need evidence, and you need evidence for depending on the pathway. So what we try to do is kind of not scare everyone away by saying you need the highest quality RCT, which is on the market. Yes, there might be the time where you need it, but probably not at the first place. Start somewhere and optimize that. And I think when we talk about, just move it in here, talk about this, it's really interconnected. If we do a reimbursement analysis, we typically end up with a reimbursement strategy, which of course will try to incorporate your business plans, but also this kind of is directly connected to the evidence strategy and to the evidence needs and supports you have. So I think that is something which should always be kept in mind, that when you do a market access planning, the evidence is a very integral part of it, and it should not scare you because otherwise it will not be a sustainable market access. So evidence is very important. It does not need to be there when you enter the market, but you should have the clear idea that you want to move into that market with the intention to create the evidence which is needed. Let me just give you a quick, here we go. So just finalizing the talk today is on pricing. I've been discussing on the different reimbursement options. And when we do this analysis, we also think about what kind of pricing is right or what kind of pricing can be done. This is a very complex task, and typically we cannot give you a value just after initial analysis because it really depends on the side you are running into. I showed you the DRG matrix, and the DRG matrix could be one approach by saying, I'll start at that and know what kind of room I have to maneuver, but it could also be the other side to cover your costs. So I think it's really start with the positioning and where are you? What is the reimbursement value there? That does not mean that you have to stick into that value. The second question is then, do I want this, or do I want to create a reimbursement initiative which gives in the long run higher reimbursement? And that means a pricing structure which is allowing me to kind of adopt the price to a changing reimbursement. You should never start too high or too low. That's very clear, because having a too low price you won't be able to move it upwards. Having a too high price will create so low sales that it's just not working. So it's really about a strategy, and that strategy is driven by the positioning, by the reimbursement situation you are in. I think we can skip that slide because we've shown that. So just as a take home, how we see a market access approach, where we have the market assessment in the center, which is driven by the reimbursement situation. The regulatory, of course, is kind of the basis for this, and your business plan as well. And the reimbursement information is driven by the competition. So are there already products on the market which give also an information on the product pricing possibilities you have, but also on your plans for clinical evidence which shows patient benefit, and of course all the connected health economics. Yeah, I think for a short run and for a quick introduction on how a market access would work in Germany, that would be it. And looking forward to your questions, and feel free to contact us if you have more detailed product questions. We are happy to help.
Perfect. Thank you, Dr. Schultz. So just on that note, if you have questions, let's start entering those into the Q&A panel. We did have a lot of questions in advance of this webinar, which is why we tried to keep the slides pretty tight with some time now for questions. There were a dozen plus questions that came in. Some of them were answered already by the slides, so we're going to focus on some of the questions that came in that need some further explanation. And as we're doing that, I see you're starting to enter your questions, so that's great. So let's start first with the first question I have here is, why is there so much resistance to change in areas of the German healthcare market, even when there is evidence to support the need for change?
Yeah, that's a good question. I would love to know that, actually. So, I mean, we have, as I said, we have a very but we have a complex structure with which has been there for a longer period of time, and it's kind of all these pillars are hindering themselves of moving in a way. You have these in the heads of the people, the inpatient, outpatient sector. If you want to create new ideas which kind of connect those sectors, it's conservative, and it's like never change a running system. And everyone is afraid that the costs are running out, and therefore people are kind of reluctant to change anything. But I think that's also a chance. If you can show with a good analysis that you are saving costs, people will be willing to support that. And we have vehicles to do that, and these vehicles are being used more and more. There are what it's called selective contracts, where single health insurance can change reimbursement for their insurees in a specific area if they want to, but of course they will only do that if they save money. So it's really about the discussion and the argumentation you have. So it can be changed, and I think there will be changes, but it's nothing which is on the system level. It's not quick. On the more local level, for your product or your method, we have to see what can be done there probably.
Okay, the question, there's actually one in the live chat as well that's similar to this, but where can I find distributors that cover a wide area in Germany as opposed to sales agents?
Well, I think your platform is the perfect example for that, and I think it's really about kind of looking into different options of distributors in the end, different options of market channels. And then what I would always suggest is being very informed about your market before you talk to the distributors. I think it's something where you need to steer them anyhow. You need to kind of be not in charge of what they do, but understand what they are doing. So I think it's really worth not looking into only one, but kind of looking into several ones, and then doing some kind of either questions or face-to-face meetings, whatever, but yeah, really looking into that.
Yeah, and I'll do a partial demo, or a short demo, I should say, at the end. I'm certainly happy to show how you could find distribution partners or sales agents actually in Germany or other markets. I would reinforce what Dr. Schultz said, which is about being prepared in advance of those discussions. I hear feedback regularly from distributors about their frustration with the lack of market knowledge that manufacturers have when they first exactly. approach them. Not understanding the basics of the market. So
yeah, and I think that's it's just more kind of efficient if everyone knows what they're talking about. So this educational part, we see this in all our projects, is the most relevant part.
Exactly. All right, so question around key opinion leaders. So what is the best way to reach key opinion leaders in a given medical space? The example they provided was OBGYN for their particular company, but what's the best way to reach these KOLs in a given market space, in your opinion?
I think it's really doing a lot of research in the beginning. So who is being kind of publishing, who's conference speakers, who is part of the German medical societies, which is actually what we do in our initial analysis for a product. That's always part of this, looking into the guidelines, finding out the committees, who's responsible for that, and choose them wisely. Sometimes it's you might have people who are very interested but do not have the kind of supporting network which is needed when it comes to reimbursement initiatives. You need reimbursement initiatives, that you need the medical societies, for example, and you need people who are willing to go an extra mile when it comes to administrative parts. So a KOL which is loving your product and wants to use it is nice, but you need one who is willing to kind of step into his administration, make sure that they file the applications he's writing, make sure that they follow up on them. And that's not the typical clinical part. So this is something where it's really kind of sometimes it's just luck. It's finding the right one. I always would endorse younger people who are also active in medical societies, because those people are kind of willing to create and shape their own position in the medical field. Those people are willing to support that if they are, if they think that the technology is right.
I guess if you're entering the German market, part of your analysis of potential distributors would be, do they have relationships with
Yeah,
key opinion leaders, right?
yeah, or just do it vice versa. If we have our analysis, talk to them with the distributors and see how they think about it. I mean,
Yeah.
we also we do not know everything. That's very clear, and we are happy to talk to other people who have other knowledge and kind of put that together. I think that's what it's all about. It's not kind of doing one stop and then everything is clear. That's not how it works.
Got it. Okay, moving on to registration process. So what does the country registration process look like for CE marked class 2 devices? I don't know if you want to kind of expand on this a little bit broader, but that was the question that came in.
Yeah, and I've seen in the chat as well that's the when it comes to MDR. So I think in general, Germany is part of Europe. So if you have a CE mark, you are allowed to market the product in Germany. And if you need a registration, really strongly depends on the product. So if you, for example, have a product which is being used as a material in the outpatient sector, there are several federal states which have just a positive list of materials. And it could be that you need to be on that list, but it's not a formal registration process or a red tape what you have to follow there. It's just it's the positioning question. Where are you? What's there? And then we have sometimes there might be some kind of a registration in quotation marks, so making sure that the product is on a list, like the medical aids list, for example. But other than that, there's no completely German registration process on a medical device.
Right. Okay. Yeah, and the question in the live chat was, as you said, was similar to that. So I think we covered that off as well.
Yeah.
When I do the demo towards the end, I will show you market discovery where we lay out a high level overview of what Dr. Schultz has talked about, and it does vary by European country as well. So as you're looking at those, of course, you've got your CE mark, but there are some local regional aspects to it as well. So this question is, I'll try to kind of paraphrase a little bit. I understand that being on the aid list does not mean immediate reimbursement, and that negotiation should happen with each insurer after that. How would you recommend to approach this process? And I'll let you answer that.
Yeah, that's a lovely question. As I said, there's a lot of contract partners involved, and typically it's a locally driven process. So you have the dispensing stores, agencies, whatever, who hand out a wheelchair, for example. They negotiate the price with you, and at the same time have a reimbursement contract with the health insurances, either having a fixed value for all the class, for complete class. So a blood pressure measurement device will be reimbursed with 20 euro, and then the store will negotiate with the manufacturers a price where they get some margin out of it, or they have a value where they get a 12% margin on any price or something like that. So it's really about finding where you are, finding what is the product here we are talking about. But for the medical aids, it will be a local process. So it's nothing where you have, this is something where you cannot kind of start with overall Germany. It will be local.
Got it. Okay. What percentage of medical devices used in the German market are within the DRG reimbursement market, and how does the process of getting new technologies into the reimbursement system look?
Mm-hmm. Yeah, I think the second question I try to answer, and I think that is then depending on the product. The first one, I think there's no real kind of split on the data. We do have a split which shows that about 40% is budget spending in hospitals, 50% is in outpatient, and the rest is for home care, emergency, and other things. But that's the total spending. So it's not the spending for the medical device sector in itself. I'm not sure. I'm not aware of any study who has been trying to do that. Of course, you could go from the company side, but we've never looked into that actually.
Okay. Looking at some of the live questions, and I'll try to group a few of these together where possible. So one of them speaks to, and actually there's a couple of entries from this person, looking for a partner for medical imaging diagnostic software. And then a follow-on question was, what's the profile of a true distributor? medical device distributors, local software developers, dealers. So I guess because they're providing a PAC system, it looks like they're wondering sort of what's the approach to going into the German market. Would distributors be the right fit? Should they be looking at complementary manufacturers, perhaps? It's a pretty specific question. Maybe you could touch on it a little bit, but if not, we could also maybe take that one offline for this person as well.
I think what should be noted on this is an investment product. I mean, I've been talking more about the patient reimbursement here. So for any risks and PACS systems, the hospitals have to do some kind of investment, and that's a different kind of a different budget situation. So if you talk to distributors, or if you talk to think about market access, you should be very well aware of this situation. And then I think it's right now, I don't know about the market situation on risk systems or on PACS systems right now. But typically I would assume that those things are bought not every year. They are bought like for several years and then being kind of changed when a new technology comes out. So I would really go into a situation where a distributor is experienced on investment products and hospital investment or clinic investment in that case. This is not about the DRG system or the EBM system. That's a different pathway, really.
Okay, there's a question here around non-medical products in the operating theater. So is the doctor allowed to use non-medical products in the operating theater? It's towards the end of the list there. I don't know if you want to touch on that.
Yeah, I see that. So typically it is, there has to be this CE mark to make sure that the doctor does not get into trouble. And non-medical product, I'm not sure what is really meant with non-medical product. I mean, of course, there are a variety of tools which they're using, but I don't know what's really meant.
Okay. If you have a follow-on to that, to the person that posted that, it was posted anonymously. So maybe if you have a follow-on, certainly feel free to put it in the Q&A.
Yeah.
Are there any other questions in there that we haven't touched on that you can?
Yeah, I like that. I like that approach with the medical aid on the medical evidence. That is something which is a lovely example on how the systems sometimes work. If you want to enter the medical aid catalog, they say you can enter it basically if there already is a product listed which is similar or something like that. But on the same page, basically they say that medical evidence is needed and needs to be shown. And that is exactly the kind of the problem that you sometimes have. First of all, if you really could show that you are the same, you can enter it, and no extra medical evidence is required. It's just an application where you kind of describe all that. But on the other hand, if you have if you cannot directly, or if you cannot prove that you are the same or similar, it can happen that they say, no, you are what is called a new method. And that new method then requires this body of evidence. And this is, I think, what it's meant with here. We have these, sometimes we have kind of situations which are counterintuitive, and you really have to kind of find your way through this jungle of statements which are there, coming from different catalogs, coming from law texts, coming from publications of the authorities.
Great. There's a question here about what are the distribution options for DIGA products?
The DIGA apps are being also prescribed by the doctor. So they are typically you have an app which is in the App Store or the Play Store. The patient does a download and then gets a code from his insurance with which he can kind of unlock the app in its full productive mode. And this code is being bought from the health insurance from the manufacturer. That's basically, so it's not a specific store, it's this typical app stores everyone knows.
Right. Interesting. So this one's fairly specific, but I'll touch on it. So this person or the company has a Class 1 medical device for rehabilitation. They're not looking for reimbursement. They want to go the self-pay route. They have their CE mark. They need a distributor. Do I need special regulation to get into the private German market?
No, not necessarily. nothing specifically needed. I would say that the distributor should be kind of very well networked with the points of sale which are then relevant. For example, if we do have a contact which is we do have in our team a member who's very well networked with the pharmacies in Germany. So, and the pharmacies also sell self-pay products. So if we do a market analysis on this, we kind of include that as well. And otherwise, nothing specific. It's really more about the sales channels.
Okay, and from the actually, this is another question from a person who we answered earlier. But is there any are there any regional responsibilities for authorization payment control? It's towards the end of the list there as well.
Yeah, they are. Yes, they are. I don't want to confuse too much, but if we look into the outpatient, if we let's kind of separate that outpatient and inpatient. In the outpatient setting, you have what it's called. We have authorizations who group the outpatient doctors within a federal state of Germany, and they kind of control how the payment is done. They do not control the amount of payment, but they control the budget. At the same time, for the inpatient, when we talk about investments, that is also being more controlled in the federal states. So yes, you have to kind of consider sometimes the federal state situation if you are slightly depending on the product. Yeah. Mm-hmm.
Okay, I think we've covered off, unless I've missed any there, and maybe you just have a second look yourself, but it looks like we've covered those off. If you have additional questions, feel free to put them in there. We do follow up after the presentation as well. I'm just going to do a couple quick things here and wrap up in the next few minutes. I am going to provide Dr. Schultz's contact information as well, should you like to reach out and further your conversations with him or his organization. So just very quickly, I do want to hit on a couple things here. So Arab Health is coming up late January. I'm sure many of you on the call today are planning or considering going. I did want to mention through our platform that we now badge all exhibitors, in particular attendees at Arab Health, which I'll actually show you when I do the demo here momentarily. And you're able to use our platform to post what we call an opportunity to promote your products or what you're looking for in partnerships, whether you're a distributor or a manufacturer. You can do that in advance of Arab Health. So I just did Medica in November. A lot of our clients use the platform to actually drive a much more engaged and selective meetings with companies at Medica, and they'll do the same now for Arab Health. So I will show you how that works in the platform, but did want to make sure that you're aware of that. Both Kalms Consulting and ourselves, myCaribou, we will be at Arab Health. My meeting link, I believe Angela is going to post in the chat if anybody would like to connect with me at Arab Health. And when I provide Dr. Schultz's contact info, you can reach out to him directly about meeting with Kalms at Arab Health if you're going to be there. So on that note, here is the contact information for Dr. Schultz as well as Marco, who's the CEO at Kalms Consulting. And I believe you said, Dr. Schultz, that Marco and Stefan, I believe, are going to be, or at Arab Health? Yeah, I'm
definitely sure about Stefan. I don't know if Marco will be attending Arab Health, but you can always contact him or me, and we will make sure that you get back to you.
Okay, and my contact information is here as well. I really want to thank you, Dr. Schultz, for stepping in last minute, really as of yesterday, taking on the presentation, covering off a lot of great content today. You know, these times with people with viruses and everything else spreading, we really appreciate your flexibility as an organization and jumping into that today. So thank you very much for your time, and we wish Marco a quick recovery. If you have any additional questions, you can put them in the Q&A panel, and we will respond to those afterwards. For those of you who like to stay on now for a quick demo, I'll cover this off in about 6 or 7 minutes. I typically cover off the platform, so happy to do that now. If you are dropping off, thank you so much for attending, and enjoy the rest of the week. So the myCaribou platform really is a robust global platform with thousands of companies actively using it to do really three key things. One is to discover markets and learn, sort of touch on some of the things we talked about today at a very high level in 105 plus countries around the world. We also provide a partnering capability where you can find and connect with new partners as well as post opportunities, which I'll touch on. And then lastly, we provide a collaboration platform where you can actually manage your partners, collaborate with your partners for better success. So I'll start very quickly with a global view. I'm a manufacturer in this case. Our customers are roughly half manufacturers, half distributors. So this is my view of the world as a manufacturer. These green markets are markets that I'm active in. These purple markets are markets that I've targeted. So for example, I'm targeting Poland. I'm targeting France. I'm active in Poland. As you look at markets, so I'll just pick Saudi Arabia as an example. We cover about 105 countries for market discovery, and that includes roughly 850 data points on each country. So an overview of the market so that you can educate yourself about how, in this case, healthcare works in Saudi Arabia, how medical devices are purchased and how they're managed in the platform in that market. We also cover off healthcare expenditure and financing. So the public-private mix, something that Dr. Schultz touched on today for Germany. We cover assets and employment. So how many beds, how many physicians, how many clinics, how many doctors' offices, how many dental facilities, et cetera, as well as things like surgical and clinical specialists. We do healthcare utilization. So if your devices, for example, are used in a particular type of surgery, we can drill in and learn more about the number of procedures in that particular area. We cover trends and indicators such as medical conditions, disease states, and then lastly, regulatory. So as I mentioned, when Dr. Schultz was talking about this, we provide a quick overview of the regulatory authority for that country, the types of licenses, and then if you're part of a multi-country registration such as the CE mark, so let's use Germany as an example in that case. In the German market, if you looked at regulatory, you would see an overview of the country-specific regulatory authority, the license types, and then of course being part of the CE multinational regime that would show up here as well. So market discovery, as I mentioned, we cover 105 countries from the US being the largest market down to whatever the 105th country is, and I really should look that up so I could say that on the fly. The second piece is finding partners. So a couple questions today about how do I find partners. I'm looking for distributors in Germany. I'm looking for sales agents. I'm looking for market consultants like Kalms Consulting. So the way the platform works is you can see there are 44,000 companies, 44,322 to be specific. And let's say I'm looking for distributors, not sales agents, just distributors in a particular country. So let's use Brazil as an example. Actually, let's use Germany since we just talked about Germany. So if we look at distributors in Germany, there are 960 that are headquartered in Germany. From there, I can start to drill down into product categories, call points, or other ways to focus. So for example, let's say I have ablation products and I want to find distributors that focus on cardiovascular products. That would take that down to 61 distributors. You can then see things like how long they've been around, what are their product category focuses, how large is the organization from an employment perspective, are they regional, are they national? A market like Germany, fairly national with some regional specifics. If you look at a market like the US, you're going to be thinking probably regional distributors, not national distributors. In any case, when you're ready to have a look at any one of these companies, you can view their profile, you can view the full profile, you can go to their website, and when you're ready to connect with them, you can connect. If they may ask you 2 or 3 questions about yourself as part of that connection request. So that's one way to find partners. If on the other hand, you're a distributor, so let's say you're a distributor and you're looking for cardiovascular products as an example, this is now a list of 1,376 global manufacturers that are in the cardiovascular space. And you could again get more specific, like for example, let's filter it down to catheters. and that goes down to 107. You can see them, from Australia, Canada, China, etc. These are all manufacturers focused on catheters. As a distributor, I could then reach out to them directly as well. Now, the other thing we can do, and what's actually more powerful than the approach I just showed to establish new partnerships, is to use something called opportunities. And to do this, I'm going to actually flip over to the live platform so you can see some examples of real opportunity posts. So, for example, this is Econ Surgical out of the UK, and they are seeking distributors. And if you look at what they're actually looking for, so they are a manufacturer out of the UK, and they're looking for distributors in Egypt, Tunisia, Libya, etc. Okay, they are focused on these product categories, so ENT, general surgery, etc. These are the call points. They describe what they're looking for in terms of a new, they're looking for distributors of their sterile single-use surgical instruments. If you're a distributor, what happens is this particular opportunity then would be match scored against your profile. And as a distributor, you can respond to that manufacturer. You'll also see postings in here that are distributors looking for particular products. So I'll give you an example. One recently was a US distributor that had a relationship with federal military hospitals and was looking for a particular product to sell to those hospitals. It was an immediate need, and they wanted to identify potential suppliers. So they posted an opportunity for that. One of the things I will point out as well is if you start to think about Arab Health or Medica or other conferences you might be going to, we have now badged companies that are attending various events. So for example, we have around 966 companies on the platform that are going to Arab Health. You can see that badge here, Arab Health, beside them. So this one, for example, was at Arab Health. They were recently at Medica as well. And so you can use this as a way, for example, to say, I want companies that are going to Arab Health that are focused on cardiovascular products, and you've got a shorter list now of potential companies to connect with at Arab Health as an example. And again, what a lot of our clients are starting to do with these opportunity posts is they will post an opportunity that says, we're going to Arab Health, we're a distributor in the Middle East, we're looking for these products. If you're interested in connecting with us at Arab Health, connect to the platform. And I know from talking to many of our customers at Medica that it was a very powerful way for them to really leverage their investment in that conference. So finding partners, market discovery, the first two legs of the platform. The third piece is all about partner management and collaboration. So this is, I'll just turn this off momentarily. This is a dashboard where I can manage my partnerships. If I'm a manufacturer, these would be my distributor partnerships. If I'm a distributor, these would be my supplier partnerships. In my case, I am a manufacturer. In Argentina, all the way through to the United States, UK, Uruguay, you can see who I've identified as my partners. Now, none of these partners see anybody else's information. In other words, Medic Supply in Canada doesn't know that I distribute through GC Medical in Brazil. They only know that we have a partnership. But what you can do with this is you can manage your relationships with your suppliers or with your distributors in this case. You can invite them in here to collaborate with you. So in this case, you'll see, for example, the people from our company that we've given access to this. And from Medic Supply, Mary Reese is our contact there, and she can collaborate with us. What I mean by collaborating is things like sharing files, having discussions, setting some objectives for the market, really important for partnering, as well as potentially sales forecasting. And I'll turn that on right here so you can see it. Here I'm doing a simple target versus actual, quarter by quarter, year by year, and you can see where we're on target, where we're behind target, et cetera. Again, remember, your partners don't see this unless you A, invite them in, and B, they can only see their line of this grid, if you will. So Medic Supply Inc. in this case, if I invite them in to collaborate with me, they can only see the files, the discussion, the things that we have really in this relationship between us. They have no idea that we are working with other distributors, potentially even in the same market that is not visible to them. One of the great powerful aspects of this is all around communication, collaboration, updating, staying in touch with your distributors. And I'll just give you an example of how that might work. Let's say we have a new product or an update to a product, and I want to update all my distributors at once, or a subset of my distributors. I could take all my distributors in this case, and let's say maybe it doesn't apply to South America, so I'm going to take Brazil, Argentina, and Uruguay out of the mix. But for all my other distributors, I'm going to send them a message, or I'm going to share files with them. So I might share a new product sheet, and it sends it out to all those distributors simultaneously, and we can start a discussion with them. They can ask any questions they might have, et cetera, et cetera. Another good example of that would be, let's pick the European ones. We're going to Medica. We want to say, hey, we're going to be there. Come see us at our booth, et cetera, et cetera. We could do that directly through here as well. So really the purpose of this is to manage those partnerships, and then when you're ready, invite them in to start collaborating with you in a single place. The value of this is that it's a single place, obviously, for you and your partners to work together to drive more successful partnerships around the globe. So again, just to be really clear, there are three key aspects. Discovering markets. We cover about 105 countries on market discovery. We can help you find, connect with new partners and build new partnerships. You can do that through finding partners or posting opportunities. And then lastly, you can manage and collaborate with your partners through the platform. We know that roughly 60% of all partnerships fail, and they fail slowly. And that's a real problem in the industry, and that's why we built the platform, was to help you navigate markets, learn more about those markets, find and develop new partnerships, and then do a more proactive, collaborative job of managing your partnerships globally. Again, our customers are roughly 50-50 manufacturers, distributors, and then we have organizations like Kalms Consulting as market consultants, regulatory consultants. We have trade organizations that are now on the platform that are using it as well to work with their partners. So on that note, we're about 5 minutes after the hour. I appreciate those of you that stayed on, that wanted to see the platform. If you have any additional questions, please feel free to reach out to us. We will send you a recording of today's presentation, the deck as well. And please reach out to Kalms Consulting. They're a great partner, great organization that can really help you in Europe. Thanks, everyone. Thank you again, Dr. Schultz. Have a fantastic rest of the day, everyone.
Thank you.